Hey guys, Shadow the Rat, and for today's video, I wanted to talk some about my little bean butter right here. So, some of you might have seen my community post, or if you follow me on other socials, you might know what's going on. But basically, Butter here started to bleed from what looked to be her vagina on Sunday night. So this was pretty concerning. Rats do not get periods. They reabsorb their uterine lining instead of shed it like humans. So you should never see rats bleeding from that area. And when you do see bleeding from that area, it can be a few different things. Most commonly, you're looking at urinary tract infections, especially if it's mixed with pee, but it's not always easy to tell if the blood is mixed in or not. It can also be a sign of a pyrometra, which is an infection of the uterus, and this is very concerning. Pyrometras can get bad very quickly. They can be found in any animal with a uterus, so dogs, cats, rats, all of them can get pyrometras. And it's a big worry in intact female animals. That was my main worry because an infected uterus can really take down your animal so quickly, especially small animals like rats. And oftentimes it doesn't respond well enough to antibiotics to just do that. Oftentimes you do need to put the animal under an emergency spay, as that's often the only way to save their life. Another thing it can be is uterine polyps, which are basically like abnormal tissue growths in areas that they're not supposed to grow. As for less common causes, you can look at genital mycoplasmosis. A lot of people in the rat community will know that rats all carry this bacteria called mycoplasmosis, and typically this is the bacteria that causes respiratory issues in them. However, it can cause a variety of other issues, including genital bleeding and genital infections, which is one of the things that can technically cause bleeding in that area, although it's not super common. Another thing that can cause bleeding in that area is cancer. For example, some of you might remember my rat Bean. She had cancer of one of her uterine horns, and that caused her to hemorrhage blood, and unfortunately she passed. We did have her go through surgery, and basically a spay was able to fix the problem. However, unfortunately, she had lost too much blood at that point, so she did not make it past recovery. So that was a big worry of mine, although I've heard from multiple vets that it's very rare to see that sort of cancer, so hopefully we're not dealing with that in Butter's case. Anyways, those are kind of the main things that you worry about when you see bleeding in that area. With males, you're usually most worried about a urinary tract infection, otherwise known as a UTI. With female rats, you usually worry most about pyrometra just because it's so common in females. That is, if they're intact. Although technically a spayed female can sometimes develop a pyrometra because sometimes there's a little bit left at the uterus, a uterine stump of sorts, and this can develop what's called a stump pyrometra, and that is just as dangerous for rats. So even spaying them, unfortunately, does not remove the entire possibility of them developing a pyrometra. Anyways, with all that being said, of course, as soon as I saw Butter start to bleed, my first thought was, oh my god, I gotta get her to the vet. So it was Sunday night, so I couldn't get her in immediately, so I started her on antibiotics, Baytril and doxycycline, which I have on hand. I also started her on infant Motrin, which is ibuprofen. It's a pain reliever, and it's also an anti-inflammatory, but it has to be given super often, about every 6 hours to see a good effect. So it's a little bit impractical to give, but as far as the short-term thing goes, it's pretty useful just because it's over-the-counter, which a lot of pain meds aren't. So I started Butter on all that, and then in the morning I tried to get her a vet appointment because it was Monday. Well, unfortunately, this week has been the week of 4th of July, and I'm in the US, so that's a big holiday here, and a bunch of places will close down, including the vets. So the vet was closed on Tuesday, which meant I couldn't get her in on Tuesday, and because it was closed Tuesday, a bunch of people wanted to come in Monday. So I tried to get her an appointment, but I was told they were all booked, and then they emailed me back and they were like, oh, we got an appointment opening for like 30 minutes from now, and so I called them back literally 2 minutes after getting that email, and it was already booked again by someone else by then. So that just kind of gives you an idea of how crazy everything was at the vets. So I was not able to get her in on Monday, and I was not able to go to the emergency vet because the closest emergency vet to me does not really see rats. Or they will see rats, but they don't know anything about them, so they'll literally just throw Baytril at you usually most of the time and say, I hope this works. And this is not me insulting those vets. They are not exotics vets. The vets that work there are just typical general vets, and they work with like dogs and cats mostly, so it's not really fair to expect them to know a lot about rats, and that's just not really a great place to go with rats. And I used to go there a lot, so I can definitely tell you it's just not a good place to go with rats. Now, technically, there's another vet I could have gone to. It's about an hour and a half away one way. And that is the vet that I took my rat Donut to when she developed her pituitary gland symptoms and needed a steroid shot. And I did not have the best experience there. They did give us the steroid shot eventually, but they made us go through a bunch of unnecessary testing. Plus, it's really far away. Basically, all in all, it's just not a place that I would go unless it was a complete emergency, which, you know, you could argue that Butter's situation was an emergency, but Butter was still acting completely normal, and I had antibiotics and painkillers at home, and so I made the decision to just wait a few days to go to the regular vet, as long as Butter remained stable, and to just keep her on antibiotics, which I started myself. So the soonest I was able to get her a vet appointment with my regular vet was Wednesday at 3 p.m. And so I took her in on Wednesday, again at 3, and the vet saw her, and by that point she hadn't bled at all since Monday. After her second dose of antibiotics, I've not seen any bleeding, which could be a coincidence. We don't know for sure if it is or not because I didn't wait. Just because of how fast rats go downhill, I wasn't comfortable waiting. And the soonest vet visit I could get with my regular vet was 2 days away. I just didn't feel comfortable, you know, waiting to start them. But there's also a good possibility that the antibiotics have had an effect, and that's why she hasn't bled at all. And the chance of that has been increasing since she hasn't bled at all again since Monday, and I'm currently recording this on Saturday morning. So she has not bled in several days at this point, and she's been on antibiotics twice a day. Now, my vet told me that because Butter's acting normal, because her stomach feels normal, she doesn't have any lumps or bumps, and because the blood was like coming out, so, you know, it was a discharge and it wasn't like just stuck inside. Because of that, he didn't think that any extra testing like x-rays or ultrasound would be really conclusive, because he told me that basically the discharge means that there wouldn't be any sort of, you know, palpable or really visual mass inside. And, you know, he's obviously dealt with more of this stuff than I have. I mean, I've never dealt with pyometra at all or anything like that. So I'm just going by, you know, what he's telling me. So we decided not to do any further testing at this point. So he was happy with the doses I put her on for antibiotics, although he told me the Baytril is going to be more helpful here because genital mycoplasmosis, which is what doxycycline would treat, is very uncommon in rats. So we took her off the doxy, so she's not on that anymore, but she is going to be on Baytril for the next 2 weeks. And I also took her off the Motrin. I only had her on that for a day, so it wasn't really something she was on long term. I only had her on it until I realized that she really wasn't feeling off at all. So then I took her off it because it wasn't really doing anything. But anyways, like I said, the vet was happy with my Baytril dosing, so he told me to keep that up for 2 weeks and do it every 12 hours, which I have been doing. And he told me that we're going to see 1 of 3 things happen. The first is that Butter just remains completely healthy. She doesn't bleed ever again. And after we finish the antibiotic course, she's just completely fine. And obviously that is our ideal situation. That means that we treated some infection. We don't know what, but it's treated and that's that. We don't have to worry anymore. The second is that the bleeding comes back after the antibiotic treatment. That tells us we are dealing with some sort of infection again, but it also tells us that we didn't completely clear it up. And that could be more concerning because if it is something like a pyometra, they will sometimes respond to antibiotics initially, but it's often not enough to clear it up. So in that case, she may need to go through surgery. In the case that she starts bleeding again, my vet actually told me that I don't even have to make an appointment. I can just bring her in, drop her off, and they will immediately swab her blood or any discharge and look at that under a microscope, see what's going on. And they will also go ahead and do some intensive testing like x-rays or ultrasound, depending on what they think is going on. So that's the second option, where she starts bleeding again after the antibiotic course is done. But the third option is that she starts bleeding again during the antibiotic course, which tells us that either we're not dealing with an infection or we're dealing with something resistant to Baytril or something that's difficult to treat infection-wise, like a pyometra. And in that case, of course, again, we would take Butter in, drop her off, and they would do more testing and swab her. So basically right now what we're doing is waiting. We're kind of in a watch and see situation because Butter's been on antibiotics now for nearly a week and she hasn't bled since her, again, second dose of antibiotics. So that's really good. But it doesn't tell us for sure what's going on. So right now we're kind of just ruling things out by doing a course of antibiotics and seeing how she does. And so far she's been doing really well. She hasn't had any more bleeding. She's very food motivated. She's all over the place. She's kind of tired right now because I just finished cleaning the cage, but she's just acting completely normal. So right now it doesn't seem like she's, you know, feeling pain or anything like that. So yeah, right now Butter is doing really well. My vet just told me, again, to continue what I've been doing. Actually, we didn't even buy medication. He just said, you know, keep using your own Baytril. If you have some in stock that's, you know, not expired, then just use it. There's no reason not to. So I thought that was pretty nice because, well, my Baytril that I have at home is a lot less pricey than the one from the vet. The one from the vet is like 25 bucks for 2 weeks, which isn't super crazy, but you know, I have a whole bottle that's like 100 milliliters. That's 25 bucks. So that will last me like 2 years. It takes like 2 years to expire if kept in good conditions, which I do keep them in good conditions, all my medications, that is. So I expect that to last me quite a while, just depending on how many times the rats need it. But yeah, that was pretty much it. We really didn't come to any certain conclusions just because we decided not to do any other crazy testing or like explorative surgery, something like that, because that's kind of unnecessary at this point. But we will be keeping a close eye on Butter, and of course I am giving her Baytril twice a day. So yeah, I am just continuing to do what I was doing, and Butter herself seems to be doing very well. So right now I'm not too worried, thankfully, because I was really worried when I first saw that blood. So I'm very glad that Butter seems to be doing really well still. And hopefully that will continue. So yeah, that's pretty much it for this video. Hopefully little Butterbean here will continue to do well, and hopefully we don't have to take any more intensive action. And yeah, I will keep you guys updated. Bye!